The Newsday continues here on One News Now. I'm Riza Diaz. Data shows heart diseases are still the #1 cause of death in the country, killing over 56,000 Filipinos in the first half of the year. Camille Samonte has the report.
Despite the COVID-19 pandemic, heart diseases remains the top cause of death in the Philippines. Based on the last report of Philippine Statistics Authority, from January to June 2021, more Filipinos died because of ischemic heart diseases or illnesses causing oxygen deprivation in the heart. Cerebrovascular meanwhile plays second. This happens when blood flow to your brain stops and may lead to stroke. It is followed by cancer, diabetes, and COVID-19. Medical experts from Singapore explain that there are 2 reasons why many people suffer from heart diseases. It could be caused either by hereditary risk factors or an unhealthy lifestyle. Oftentimes, eating too much fatty food, salt, and sweets may lead to heart illness, as well as lack of exercise and excessive drinking and smoking. If you experience chest discomfort, shortness of breath, tiredness, dizziness, and palpitation, it is best to consult a doctor. A medical expert said most patients with heart diseases are already severe and has complications due to irregular checkups.
It's important to be careful with our lifestyle, be aware of symptoms, not to push back and assume it's harmless. These symptoms of shortness of breath and chest pain may be something like a warning sign, and usually that should be evaluated. I think identifying disease early and treating them earlier, it remains the most important tool, as you know, prevention is so much better than cure.
Another doctor, meanwhile, emphasized the importance of having a healthy lifestyle to prevent heart diseases.
We always advise lifestyle changes. Again, in terms of lifestyle, exercise, weight loss, and a low-salt diet. So again, even before we consider further therapy, look at the patient in general. Is the patient overweight? Is he sleeping well enough? Is he very stressed? Again, see if there's any adjustment to lifestyle that can be achieved to lower the blood pressure.
For News 5, Camille Samonte, we are One News.
Tabuk City is digging more graves at its local cemetery in Banawag in preparation for more COVID-19 deaths. The Tabuk City Public Information Office said the Balong Cemetery, which saw the most number of COVID-19 related burials so far, is now almost full. This as the city is experiencing its worst wave of COVID-19 infections. The province of Caliga has recorded 170 new cases on Friday, its highest so far. Most of the cases were from Tabuk City and 5 other towns. Now, to tell us more about the COVID-19 situation in Tabuk City, we have with us this morning their City Public Information Officer, Ma'am Aurora Amilig is joining us. Ma'am Aurora, good morning.
Yes, hello, good morning. Thank you for having us. So yun, magandang umaga po.
Thank you for joining us, Ma'am. Magandang umaga po. Can you give us, Ma'am, the latest COVID-19 situation, the cases, the number of cases in Tabuk City?
Well, yes. Unfortunately, I don't have the latest as of yesterday because I was waiting for the report of the CHO. So the latest that I have here was last Friday. We already have 645 cases, active cases, and most of them are in our treatment facility in Agbanawag as well. So we have a 100-bed isolation facility there. And then we have to use the evacuation center as well, which is beside the area, for all those cases that for the positive cases that are in that temporary treatment facility. And some of them are already in several hospitals within the city. And unfortunately, all of the level 1 hospitals here in Kalinga have already issued advisories that they're no longer accepting COVID patients because the hospitals are full. And so what happened now is most of our cases, the new active cases, are now on home quarantine. which is most alarming because there's so many of them. We can't really. There's a difficulty in monitoring home quarantine patients. So that's the situation in Tabuk, and we have recorded 46 deaths since Friday, but I think we have additional 3 this weekend. And like you said earlier, the city local government has ordered the digging of additional graves in another barangay, which is Barangay Agbanawag, because the burial site in Balong for COVID cases, according to the barangay officials, it's nearly full. So that's the reason why we had to use the other identified burial site in Barangay Agbanawag. So we dug 10 sort of graves last Friday, and I have a feeling that they have already used up 2 of those graves during the weekend. Yes.
Ma'am Aurora, given all the situation that you are, of course, sharing with us, how are the hospitals, our healthcare workers, and overall the city coping up with the surge?
It's the advisory of all the hospitals, because we have shared most of the advisories. They're already asking for people to not to go to the hospital unless it's an emergency. These are emergency cases, and because they don't have any more rooms and beds for patients, because aside from the COVID patients, they are still catering for non-COVID patients, but they have to separate the wards. So it's what can we say? I think the health system in Kalinga, it's really a little bit the situation is not really good, basing on what the health workers are saying, and most of our frontliners are already tired. Some of our doctors and nurses and the other frontliners have been infected with the virus as well. So the manpower the manpower in hospitals are already down in numbers as well. So that's the situation at the moment.
It really sounds overwhelming, ma'am. But we'd like to check also on how your vaccination rollout is going in at Tabuk.
Well, yes, we had the vaccination last Friday. So we had the highest recorded in one day. A lot of people were waiting for the vaccines. Unfortunately, we have a very, we don't have that much doses given. For the Pfizer vaccine, we were, I think, only given 1,000 doses. And for Sinovac, I think another 2,000 doses. And the turnout on Friday was, it's 1,700 plus people came to the vaccination sites within the 4 RHUs. We use the 4 RHUs as vaccination sites. So people were there even as early as 3 a.m. just to avail of the vaccine, but unfortunately we ran out of vaccine. But also, Tabuk City has already vaccinated 80% of the targeted population. So that's nearly 20,000 of the targeted 80,000 population for us to hopefully ensure that there's a herd immunity in this area. So people are wanting to be vaccinated, but we don't have the vaccines needed for that as well.
With that being said, Ma'am Aurora, it leads me to the final question. What kind of help would you be needing, let's say, from the national government?
Okay, we were talking with the mayor yesterday, actually last night, and he's actually having an issue with oxygen because hospitals are running out of oxygen, or they have actually run out of oxygen. And he wanted to purchase, these oxygen concentrators. We were discussing about the oxygen concentrators, portable ones that can be used even in our treatment facility, since the hospitals are no longer accepting symptomatic severe cases. So he was actually thinking of purchasing those, and then we can use them in the treatment facility of Tabuk City. So there will be no need for this, because most of our symptomatic patients, they have difficulty in breathing, and that's what they need. So he was proposing, I think, to purchase around 20 units of oxygen concentrator. Unfortunately, the suppliers have increased their prices because we bought 12 around March this year. So prices have doubled now, but he said nonetheless that's what we needed. And also vitamins for people here, because that's what the people are asking. that maybe the city government can roll out vitamin C and other vitamins to boost people's immune system. So that's that's the situation, and I think that's the oxygen concentrators and oxygen tanks are needed here in Kalinga, especially in the hospital.
Well, Ma'am, we'd like to thank you for sharing with us your time and all those information. Stay safe. That's Ma'am Tabuk or Mama Aurora Amilig, Tabuk City Information or Public Information Officer. Maraming salamat po.
Thank you very much.
Now, the situation in Tabuk City is in line with OCTA's warning that there are very serious COVID-19 hotspots emerging in other regions in the country. Professor Guido David said that these include parts of Region 1 and Region 1, Isabela and Cagayan in Region 2, and the Cordillera Administrative Region. David said that the healthcare utilization rate in these areas are now at critical level.
It's very serious in parts of Region 1 and especially in Region 2 in Isabela and Cagayan. The healthcare utilization rate is very high. It's actually at critical risk, and also in Cordillera Administrative Region. So these are some of the areas that we're looking at right now.
Baguio City may have to endure 2 more months of the Delta variant as the city's R0 is now higher than NCR. In a social media post, the Baguio PIO said that the city's COVID-19 surge shows no signs of letting up for now. But Baguio City Mayor Benjamin Magalong says the period can be shortened with continuous restrictions and compliance with health protocols. Magalong is hopeful that these measures will shorten the rest of the Delta surge to just over a month. A city health service officer, however, said that Baguio City has now surpassed all its recorded peaks since the pandemic started, with the city recording its highest ever daily case earlier this month. The LGU is now urging its residents to strictly follow public health measures like staying at home as much as possible. Let's now take a quick look at today's other top stories. Typhoon Mindule continues to rapidly intensify over the Philippine Sea. The typhoon is expected to enter the Philippine area of responsibility by Tuesday or Wednesday. The Health Department is urging caution in interpreting the recent COVID-19 data. The Department of Health said the lower case turnout is due to several factors, including fewer tests and higher antigen testing. Recall that results of antigen or antigen tests are still not included in the agency's daily case tally. And Barangay Ginebra clinched the final playoff spot in the PBA Philippine Cup. That's after winning against the Phoenix Fuel Masters in a do-or-die playoff match yesterday. And those are the top stories of the hour. Join us later again at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.